Good evening, everyone. Thanks for having me here tonight. Been really excited about coming to talk to you a little bit about some of the healthcare policy. The freedom in healthcare is the topic we're discussing tonight. And I've been, as Mike said, to a number of Liberty on the Rocks meetings over the years, and I've always enjoyed the fellowship and the food, and always learned something from the guest speakers. So hopefully that'll be the case for you guys tonight. So what I thought I would do is maybe share some of the perspectives that I have as a friendly family physician, some of the issues that we've been dealing with healthcare in the last several years, and how that's been affecting our practice and how that's affected our patients, and kind of how we've adapted to some of the changes. So I don't know if you guys recall, but around the time that the Affordable Care Act was about to be passed, there were a lot of kind of pro and con arguments, and I specifically remember being told that my premium would probably go down maybe an average of $2,500 a year. And I also remember being told that if we liked our doctor, that we could keep our doctor. And I was kind of under the impression that the goal was to make sure that everybody had insurance and that this insurance would be affordable. Well, that's not exactly how it worked out. Subsequently, we had a number of headlines that would come out pretty much every day talking about how people were losing their plans, and so they wouldn't necessarily be able to keep their doctor. We saw premiums going up and up. And we saw that really the individual market was essentially was devastated, and what we did is we ended up shifting people into Medicaid. I want people to leave here basically with the understanding of three things. One, I think you guys probably already understand that health insurance is not health care. And I'll give you some examples of that. The second thing I want people to walk away from here with is, how do I explain, how do I understand what is undermining affordable health care in America? And then lastly, I want to make sure that you are able to leave here with some tools, maybe with some ideas. You guys are going to know a lot of these already, but I want to lay out some of the things that have worked for my patients, so that you can continue to have access to health care, and that hopefully using these methods, you can mitigate the cost of your health care. So the first one, having health insurance is not the same as having access to affordable health care. I'm going to give you three examples. So last March, I had a patient was on a traveling baseball team. They were in Nevada, and he went to catch a ground ball, and the ball popped up, hit him in the lip, and popped open his lip. He said, well, okay, I'm going to have stitches. So he went to the local emergency department, and he says, look, the doc spent all of 10 minutes with me, and that makes sense. It doesn't take that long to repair a simple laceration. And came back home, and over the next couple of months, he received a couple of bills. Well, when all was said and done, his bill was $3,500. For a simple laceration repair. And he asked me, he said, how much would this have cost if I had come to you? I said, well, going through your insurance, I can't tell you for sure, okay? But if you were to pay cash, it would have been $150. And I don't think that necessarily made him feel any better, but then he went back to the hospital, and he's, I think, still fighting them. Turned out, he's a small business owner in Boulder, and he has one of the best plans, but this hospital was out of network. Second example, another patient of mine. His son, who's also a patient, was experiencing some abdominal pain, went to the emergency room, and they started an IV, gave him some fluids, gave him some pain medication to make him feel a little more comfortable, drew some labs, and then got a CT scan of the abdomen and pelvis. Well, 2 hours later, he's feeling better. They didn't find anything, and so they said, you know what, we don't see anything. We're not sure what was causing your abdominal pain, but we're going to go ahead and discharge you home and follow up with your primary care doc. Guess how much his bill was? $18,000. Okay, so he brought me his EOB, his explanation of benefits, and we looked at it. And fortunately, to the insurance company's credit, the insurance company stepped in and said, whoa, that's outrageous. You can't charge him $18,000. You can only charge him $12,000. Of that, $6,000 is going to be the patient's responsibility. So I think he actually is in collections right now because they've been trying to fight it. And so anyway, I don't know how that's going to work out, but I know he's been trying to negotiate down a lower rate, but he's been unsuccessful. But I looked at the explanation of benefits, and I saw that just for the CT scan, now this would be a CT scan of the abdomen and pelvis, technically 2 CT scans, it would be with contrast. I know for a fact that I can go to an imaging facility down the street and I can get that same CT scan. Individually, you can get it for $300 to $350, depending on whether it's with or without contrast. So we'll assume it's with contrast. And then to get 2 of them, you're looking at about $650 to $700. So they were charging him $6,000. Final example. So another patient of mine, his daughter, she's also a patient, I'm a family physician. She cut her finger and she severed a tendon in her pinky finger. And he called me up and he said, can you fix this? And I said, well, no, that's actually going to require you to see a hand specialist. And so I gave him some names of some hand specialists I like, and I referred him. And turns out there were no hand surgeons in network. Also turns out there were no hand therapists after she had the surgery in network. So he ended up paying for these, still using his insurance, but everything was out of network. When all the dust settled from that, his bill was $25,000. So that made me feel sick to my stomach, and I'm sure it did him too. But what really scared me about that was that I had the same insurance plan that he had. And this was in 2014. And so I pulled out my policy and I started looking at the fine print, and I noticed, okay, I know I pay $1,500 a month for my premium for myself and my family. I have a $2,000 deductible per person that maxes out at $6,300. But after that, I get to pay 50% up to $12,700. And if you read a little further along there, the fine print, that's in network. Out of network, I could be responsible for up to $38,000. And that got me thinking, what if I or one of my family members are in the intensive care unit in December? And this is, doctors think worst case scenario. So I'm just going through this. I'm going, what if we're in the ICU in December and my deductible resets and I'm still in the ICU? I could be on the hook for up to $76,000. Anyway, I don't have that insurance plan anymore, but I'll come back and tell you a little bit more about what I'm doing now later. But the point is, health insurance is not health care. And those are very specific examples of why. Now, granted, people had access to care. But let me ask you this. Do you think they're going to think twice before they go to the emergency room again? Or before they go see the doctor? I mean, there's a lot of people out there that have gone through similar situation that are now scared to death to see the doctor. The second thing that I wanted you to walk away with is what are the drivers, if you will, undermining affordable health care? The first one I would say is the almost total lack of transparency in pricing, okay? So if you go see the doctor, they may run a test, get some labs, order a chest x-ray, and maybe send you home with a prescription. Where else in America do we go into, say, a store and we load up the cart, or maybe we have someone else load up the cart for us, and then we just walk out of there saying, bill me. I mean, we're not even looking at the prices. That's pretty scary. So we have no transparency. Now, Senator Lundberg and I can't remember the name of the House sponsor, or Lontine, both sponsored a bill this last year, and it's called, I got the exact name of it here, Transparency in Direct Pay Healthcare Prices. And so basically their summary is the bill creates the Transparency in Healthcare Prices Act, which requires healthcare professionals and healthcare facilities to make available to the public the healthcare prices that they assess directly for common healthcare services they provide. And it actually went into effect January 1st of this year. So now, if you go and see the doctor, whether it's in a freestanding outpatient clinic or if you go to the emergency room or to the hospital, they should have prices posted. It's not happening yet. And a lot of, unfortunately, a lot of the administration at these hospitals and various facilities aren't even aware of it. But it passed. This is law. Now, I will state, yeah. Now, I will caution you. What's that? The transparency in direct pay healthcare prices. So, just to be clear, though, direct pay, this is self-pay. If you bill it through your insurance, you still will not know what's going to happen, okay? And I'll talk a little bit about that in a second when I talk about the second driver. In fact, we'll just talk about that now. So, who sets the prices for healthcare? So, there is a code for every health service that's provided. And there is a price tag attached to each of these codes. Who sets those prices? Anybody know? The federal government. Okay? Where does the federal government kind of get the idea for these prices? Well, you have a panel of physicians, and no offense, they're mostly specialists. So, doctor. And you've got a panel, and there's 29 of them, I believe. And what they do is they go to the federal government and they say, well, this is what we think patients should pay us. What's wrong with that picture? Yeah. They're lobbying the federal government and not the patient. Yeah, exactly. So they're using the force of government. I mean, anyway. Yeah. Right. Yeah, exactly. Exactly. That is exactly the point. So if you have no transparency and the prices are fixed, how can you haggle? How can you shop around? It's sky is the limit as far as pricing is concerned. So now the insurance companies come around behind that because technically that is for Medicare. Those are Medicare rates. When an insurance company comes in and they're asking a provider or a hospital to join with them, they say, we will pay you 150% of Medicare, for example. But they're still using those prices, so that sets the standard. Everything is based off of those Medicare prices. So what's kind of interesting about that, though, is that where is the accountability in all that, too? So if you go see the doctor and they say, sorry, I don't have any control over this, it's the insurance company, and the insurance company say, sorry, I don't have any control over this, this is based off of Medicare, where do we go? We really have no say in this unless you step outside of the system and do self-pay, which I'll talk a little bit about in a second. So the third thing that undermines the affordability of healthcare in this country, in my mind, is that patients are not in control of their healthcare dollars. And that may sound redundant because we just talked about, there's price fixing and there's lack of transparency, but there's more to it than that. So you may feel like you have a little bit of control when you have an HSA, for example, and you have some money on a credit card that you can use to pay bills. But those bills generally are still, the prices are fixed and there's no transparency. And then when you get the bill, then you use your HSA to pay. But the problem is we don't really have an insurance system right now. We have a prepay plan, okay? And what I mean by that is we're very focused at this point with this prepay plan. I'll give you a specific example. Minimal essential benefits. Under the Affordable Care Act, minimal essential benefits. This is what you must cover to be considered insurance. What are the minimal essential benefits? There's 10 of them. But if I read through them, you'll find it's basically everything. So it's ambulatory patient services, so outpatient care. It's emergency services. It's hospitalization or inpatient care, maternity, newborn care, mental health and substance use disorder services, including behavioral health treatment, prescription drugs, rehabilitation services and devices, laboratory services, preventive and wellness services, and chronic disease management, pediatric services, including oral and vision care. Wow, that's everything, and that's considered minimal. That is a prepay plan. Everything is covered. So what happens when you have a prepay plan where everything is covered is that the focus now becomes the deductible. And the goal almost, well, okay, what usually ends up happening is, let's say at the end of the year, you've hit your deductible. You go in and tell the doctor, okay, you know what? I've hit my deductible. Let's get everything. Let's get that MRI and get some labs and just order everything. I'm not saying everybody does that, but there's kind of a tendency to do that. You figure, you know what? I've hit my deductible. I don't really have any costs at this point. Let's just get it all done. And it's not that people don't care about the costs. It's just they almost don't matter at that point to the patient or the doctor. And so you can see if you don't have transparency and you have a monopoly on pricing and patients are not really in control of their healthcare dollars, again, sky is the limit as far as the healthcare costs are concerned. There's no downward pressure on costs at this point. And so what I want you to do then is, now that you think about those things, is when a policymaker proposes something, whether it's something like the Affordable Care Act or single payer or something, ask yourself, does this improve patient transparency, or does it pricing transparency? Does this get rid of price fixing? Does this give me more control over my healthcare dollars? So those are questions that we should be asking ourselves. Now, that's kind of depressing, actually. So I want to give you guys some things to potentially empower you. So these are things that you can do that hopefully will allow you to continue to have access to healthcare and have it be affordable. The first one is self-pay. This is, if you're going to be admitted to the hospital, you're going to have a major surgery, you really should have insurance, okay? I mean, it's reckless not to have some kind of plan, just in my opinion, unless you're very wealthy. But if you go and see the doctor for a sore throat, for a sinus infection, and really for your preventive care, you should be paying cash. And the reason that is, now a lot of insurances now will pay for preventive care, and so you're like, well, it's already paid for, okay? There's that mentality of it's been paid for, so I'm going to go use it. It's the prepaid plan. But if you pay cash at the time of service, you're going to save a lot of money. Granted, there's going to be a little work on your end to then save those receipts and submit them to your insurance or your medical plan so they can go towards your out-of-pocket or your deductible for the year. But perhaps our goal should be to not hit the deductible. You hit the deductible, you hit the deductible. But wouldn't it be nice to save some money? So if you go and see the doctor and you pay them, for example, $100, if you were to bill a similar visit, you may be paying $150. So you've saved $50 for that. Okay, that's not as impressive because time is money, right? And you have to submit things. You know what? I may just make the calculation that I'm going to pay the extra $50 so I don't have to deal with the paperwork. The problem is, if they start doing tests when you come in for that simple visit, let's say I order labs. I have seen, and I've had other patients track this as well, a markup of 7 to 10 times the price of what we can get for self-pay for imaging and for labs. That's big, 7 to 10. So what we can get for $100, we're talking complete blood count, comprehensive metabolic profile, looking at kidney function, liver function, electrolytes, doing a screen for diabetes, checking your thyroid, checking your fasting lipids, all that we can get for $100. You can get it for less if you really shop around. Hospitals are billing, insurance is allowing $700 to $1,000 for the same labs. and it's done through the same lab. Imaging, $300 for a CT scan, $400 for an MRI. I mean, we're seeing, $3,000, $4,000 for the same thing done at the same facility. So paying cash can make a lot of sense. And you can then you can haggle with the doctor. I mean, a lot of doctors will kind of haggle with you. And again, if you're going to do the transparency law, we've had people that go into the ER and they're saying, it was $165 for cash. So self-pay is a great option. Really, this is the only way to know for sure what your costs are going to be. One other thing I just want to bring to your attention too, if you go to a hospital or an emergency room, you are also going to be charged a facility fee. So not only is there a provider fee, there is a facility fee that could essentially double your costs. And the facility fee, they basically say the rationale is that, look, you've got a hospital here, you're staffing it 24/7, you've got maybe a neurosurgeon on call, and so, there's some overhead associated with that, and so they allow hospitals to charge facility fees. But where it's really kind of insidious, in my opinion, is if a hospital buys a freestanding outpatient clinic, that clinic now technically can charge a facility fee. So you're going to the same doctor that you saw before, only now that doctor maybe sold the practice to the hospital. They're still seeing you. It's still the same clinic, same doctor, but now your bill's going to be a little higher. And, just for like a simple visit, I've got some charts in here that kind of do some comparisons. If your visit would have been billable for $107 through Medicare, it would be maybe then $177 with a facility fee. So it's not quite double in that case, but if you start going up in complexity on the codes, you see it gets to be where you're almost doubling your cost. So just something to be aware of if you're going to an outpatient clinic that is actually owned by a hospital and you don't have really good insurance, or if you have a high deductible, you could end up paying quite a bit more. So, but really, again, the savings are going to be particularly noted in the outpatient setting when you're doing your labs and your imaging and paying for your prescriptions cash. So, another option we've talked about, most people are familiar with Concierge. So Concierge and direct primary care are other great options. These are where you contract directly with the primary care doctor for your primary care services. Again, that's not going to cover your hospitalization or surgeries, so you want to make sure you have some kind of backup plan in place. So Concierge tends to be a little more expensive. You're looking at maybe annual memberships of $2,000 to $3,000. They may offer some additional services, and you may actually have like the doctor's cell phone. Direct primary care is oriented a little bit more towards trying to save you money. And so, for example, and I'll do a little plug for my practice here, actually. So I accept Medicare. We do commercial insurance. We do self-pay. We post our prices. But we also offer our patients an option to do direct primary care. And our memberships are $79 a month for an individual. They're $119 for a couple, $149 for families, even if you got like 3 or 4 kids. And what that basically allows you to do is you get 1 free physical a year. I should say 1 included physical a year. You're paying for it. See? So, and that includes EKG, lung function testing. And then you can come in as often as you want. And, don't normally necessarily want to go just hang out with the doctor, but, there's some people who end up seeing the doctor once a month, or, they got 3 kids sick at the same time and they bring them in. And, really, if we had billed that through insurance, it could have, cost them, $400, $500. And so at that point, they're going, you know what, that, $149 I'm paying a month really has worked out. We also really try to make sure too that, if we write for, we try to be cost aware when we're ordering labs and imaging, and then we give you those prices so that you know what you're going into. And we've negotiated some pretty good deals with the hospital on labs. So Concierge and direct primary care are some other options as well. Short-term insurance. So this is actually, a lot of people are hearing more about short-term insurance now because there's been some changes. This was short-term insurance basically is a bare bones insurance, does not cover preventive care, doesn't cover your primary care office visits if you're just going in for a sore throat. But what they do is they cover your hospital and your emergency room visits. Really kind of what insurance almost should be, in my opinion. It covers the emergency stuff, not the day-to-day things and the simple things that really you should be negotiating with your doctor about. These plans were kind of viewed as a threat to the Affordable Care Act, and so they were being phased out. And as of this last year, the longest that you could get a short-term insurance policy was 90 days, whereas previously you could get one for pretty much 364 days. So the current administration expressed an interest in kind of rolling that back, and then I think it was in October, basically said, you know what, we're issuing an executive order undoing the previous executive order that was phasing these out, there'll be a 60-day comment period, and it may have actually already happened. It was supposed to sometime in this month, so it might have happened already, and I may have just missed it. But we were going to be allowed to do. Isn't that interesting? We're going to be allowed to purchase these 12-month plans again. And so these are definitely something to look at. And just to kind of give you a price point comparison, whereas the average, I got the numbers here. So premiums in 2016 on average were $109 a month for individuals. And that's pretty affordable. $264 for families compared to some of the Obamacare compliant major medical plans, which average $378 for an individual and $997 for families. So the thing to kind of keep in mind with these plans, isn't that interesting though? That's about a third or less than a third the price. So when you strip away kind of the simple stuff, like when I go to the doctor for my sinus infection, I go to them for something simple. If I paid $100 and I did that maybe a couple times a year, but I'm saving $200 a month in my premiums, and if I paid for my preventive care, you're actually really coming out on top. And so just something to compare to. I mean, we're looking at different test tubes basically, and that's one of the things that's kind of happened with the Affordable Care Act is people are experimenting and lurking around, and whereas maybe 10 years ago a lot of us didn't even care because insurance was mostly affordable. So consider the short-term insurance plans. Another thing that I love, and I'm a member as well. I'm not the president, but I am a member. The medical sharing plans. You guys have probably heard about those, like Liberty Health Share and MediShare. So I'm a big fan of Liberty Health Share. Again, not a paid representative here, but remember how I told you I was paying $1,500 a month for my insurance? With Liberty Health Share, they cover you up to $1 million per incident. You're out of pocket for the year for our family. For an individual, it's $500, but for a family, you're out of pocket for the year is $1,500. I pay $449 a month for that plan. So I'm paying I'm saving $1,000 a month just right out the gate. And then instead of having this deductible of $12,700 or potentially out of network $38,000, my out of pocket for the year is $1,500. They cover your preventive screens up front. So we've taken the kids in for physicals. They paid for the physicals, and they paid for their vaccinations. And we haven't gotten a bill for any of those things too. So I highly recommend them. They became very busy in the last couple of years because a lot of people discovered these plans and said, whoa, man, the price point on these is really good. And so they grew quite a bit. And so it did affect the customer service a little bit there for a bit, but they're kind of coming out of that, and they eventually they're paying everything. So the thing to kind of keep in mind with these is, like the short-term insurance policies, your pre-existing conditions are not covered. Now, depending on what your pre-existing condition is, if it's just high blood pressure and you're like, you know what, the chances of me ending up in the ER with a complication related to my high blood pressure is pretty low, I'm going to take that risk, and you're probably fine. But if you need a neck surgery, like in the next 3 months, this would not be the plan for you. So consider the medical sharing plans. Some other things. They act, so with the medical sharing plans, and this may be moot because things are changing very quickly, so one of the benefits was it was not subject to the individual mandate. So it was considered a qualified plan. Again, that may be moot now. You can also sign up for them outside of open enrollment. So whereas everybody now has to wait until a certain time of the year to buy insurance unless they have one of the exclusions, you can sign up whenever. And I signed up, a 2-3 years ago in like June or something like that, and showed it to my tax guy, and he was like, "Yep, that's good. Check this box, and you're not paying the individual the penalty." Association health plans. So this is the last one. The association health plans, these are for small businesses. So again, the current administration has proposed new rules that will make it significantly easier for small businesses to band together and purchase plans on par with large employer groups across state lines. Okay, so these plans do not have to meet many of the minimal essential benefits, and so we're anticipating that those premiums are going to be much lower. So anyway, I've kind of run over, so I will cut it short there. But do you guys have any questions? And I will try to answer them. Yes. Oh, thank you. Thank you. My pleasure. Yeah. So yeah, let me clarify that. So really what I'm talking about there is if you have a pre-existing condition. So if you have chronic degenerative disc disease of the cervical spine, you're like, you know what, this thing is killing me. I've got radiculopathy down my arm. I got numbness, tingling, I got some weakness. I'm probably going to need a surgery sometime sooner rather than later. They're not going to cover that. They don't cover it for the first year. Now, one of the nice things about Liberty Health Share is that after a year, they will cover up to $25,000. The next year, they'll cover up to $50,000. And I think after you've been with them for 3 years, they'll cover it at 100%. So they're not trying to exclude people with pre-existing conditions from having coverage. Basically, they don't want people jumping in for 3 months, getting a $25,000, $30,000 surgery, and then dumping the plan. Does that answer your question? Yeah. So I mean, ideally you're healthy, and that's always the ideal, right? But for these short-term policies and for the medical sharing plans, if you have a pre-existing condition, you might have to consider. So, for example, my patients that have a history of cancer, I may say, you know what, if that comes back and it's not going to be covered by these things, you may just have to go ahead and take one of these regular insurance plans with a high deductible. So, any other questions? Yes, sir. It's CMS, so Centers for Medicare, Medicaid Services. Yeah. Well, there's tentacles, okay, right? So the AMA is actually part of, there's special interest groups that kind of lobby that. So yeah, they're involved. Yeah, they're all on the same team once they get to that level. Just let's be clear. Right? So. Yeah, and and you kind of get into the larger, almost philosophical issue of, okay, Congress no longer makes the laws, right? They pass a framework for a law, and then they pass it off to the executive branch to promulgate and actually make the law. We've mentioned the 1,442 instances where the Health and Human Services Secretary shall do this or has authority to do that. So other people that are unelected, that are career bureaucrats, are getting to make all those decisions right now. Yeah.
Do you know how well accepted they are, and is it difficult to get doctors to accept that?
Yeah.
Number one, and then number two.
So when we say they cover up to $1 million per incident, I think they're responsible for $150,000, and then they're actually underwritten up to $1 million. So there's actually an insurance company on top of that. And they've been around since the 90s. So as far as their, fiscal sustainability and all that, they seem very sound. What was the other question? Oh, doctors accepting them. So actually, that's one of the beauties. That's one of the pluses of those plans is there is no network. So you go to the doctor and you can say, I've got Liberty Health Share, but you're almost better off again just saying, hey, you know what? I'm going to pay cash for this visit. And then you submit it to Liberty Health Share and they apply that towards your out of pocket. Yeah. Now there are doctors, and I'm one of them. I'm credentialed with Liberty Health Share, and I was all gung ho to go out and go to the hospitals and make sure people were also credentialed with Liberty Health Share because I thought, well, that might make that a little more seamless, a little continuity of care there. And Liberty Health Share was like, no, don't do that because that confounds our ability to negotiate the bill, because what they do is they're really good at negotiating. So they had an instance a couple of years ago where somebody had an $800,000 hematology oncology bill for chemotherapy or whatever, and they negotiated it down to $300,000. And that's pretty typical that they're able to get it down to a third the price. And if they were credentialed, like they are with me actually, so they say we will pay you 150% of Medicare. I don't have any negotiating at that point, and so I just tell my patients, pay me cash, and then they get a better deal. And if the hospitals were credentialed, they would have to bill through that. So, but you just go anywhere you want. And if you think about why these plans were originally founded, it was because they were people going overseas that were actually for medical missionaries, and there are no insurance companies, over there. And so it's just like, we will then pay your bill for you. I know a lot of there's some group policies where the employer will offer some incentives, but I can't give you specific details on that. I thought at first you were asking what other preventive services do they cover. No, not that I'm aware of off the top of my head. Makes a lot of sense, but your question basically is almost assuming that would be good for their business model, and you'd say, well, gosh, if I've got a diabetic and I want to make sure that they're staying healthy and keeping their sugars under control, because if they get hospitalized, it's going to really cost our insurance company a lot of money. Well, people are very mobile these days. They don't keep insurance companies from year to year to year, and so really all they're thinking about is this year. They're not thinking about long term because your insurance is going to be different next year. And it's interesting. Ben Carson actually proposed something, and this actually is really cool. They're called health freedom accounts, and basically you would be assigned an account at birth, and so that would be completely portable, because after you left home, you would have that plan. If you went to college, you would still continue to have that plan. If you went to an employer and changed employers, you would still have that plan. Your insurance, your family would basically function as its own little insurance company. You could share HSA funds. It also would make moot pre-existing conditions. So that would be something that would be very, portable. So hopefully we see something like that at some point. Yes, ma'am.
Yes. Question for you. Any advice for small business owners who are trying to cover their employees and want a comprehensive kind of plan that they can understand? And how do we integrate all this information for them and provide a plan that's good for the business owner, the small business owner?
So I'm a small business owner, and I kind of have the same thing where, I want to just be able to offer Liberty Health Share for all my employees. That definitely, but some of them have pre-existing conditions. And so then I also offer an Anthem Blue Cross Blue Shield plan. And then we do dental and vision separately. And so you can offer them a suite of options, basically, and say, look, and you can incentivize it too. Like, my employees that are, maybe doing Liberty Health Share, I'm actually saving money, because when I pay for the Anthem Blue Cross Blue Shield plan and I'm splitting it maybe 70-30 with the employee, I actually pay a lot more for that one than I do the Liberty Health Share plan. So I'm like, you know what? If you pick this plan, you're actually saving me a couple $100, and I'll just kind of give that back to you, and we'll put that, whatever. So that's some of the things you can offer. Another thing that some companies will do is they will partner with a primary care practice as a direct primary care option, and say, you know what, we're going to offer for our, just kind of as an incentive or almost like a reward for our top employees, we're going to offer you this direct primary care plan where, you'll pay the $79 a month or whatever. And when we work with a business, we may actually discount that to, depending on how many employees they have. If they got 10 or more employees, maybe we're doing like $59 a month. And so then their employees know that, hey, when I get sick, I can actually go see the doctor, and I'm not even going to get a super bill for it. I'm not even going to get charged for it. So there's kind of a suite of options that you can offer them. So, but yeah, read the fine print though on the insurance stuff. Well, thank you guys. I had fun.